Welcome back. Thank you for staying with us. We're continuing with our conversation with Dr. Peter Kamunyo, CEO, NHIF. We also have Dr. Jackie Kitulu, Kenya Medical Practitioners and Dentists Council board member. Ladies and gentlemen, thank you so much for staying with us. I know I've kept you for a while, but I appreciate your time and staying with us. So just before we ended the first part of that conversation, Dr. Kitulu had mentioned that there is cover, but it is not universal. There are individuals, healthcare workers who do not have the health cover that can cater for them and their families as well. And that's where I want to pick up Dr. Kamunyo. Affordable healthcare in Kenya. Where would you say we are at, looking at the fact that we're just about to observe the Universal Healthcare Day in a couple of, is it this weekend?
Yes. On Saturday.
Yeah, so where are we as a country in terms of affordable healthcare?
We've actually made great strides in terms of affordable healthcare. And looking at the structure and membership of NHIF, whereby we have two main groups, and that is the formal sector, who have the statutory contributions, and then the informal sector, whom we also say is voluntary. And it is actually in the Act that all people who are earning should contribute towards NHIF. And once they contribute, they have access to our super cover, which has a suite of benefits that we have progressively been improving to ensure that it addresses the needs of the people of Kenya. And this includes, inpatient, outpatient covers for surgery, covers for cancer, oncology, radiotherapy, and chemotherapy, including even cover for drug abuse rehabilitation, and even organ transplants. So it's a very comprehensive cover. But we know then, in that case, there would be a group of people who cannot afford at all. And those are the people we're referring to as indigents or the vulnerable population. And this is a population that the government of Kenya is committed to ensuring that we support, and starting with the support of the 1 million households out of the 5.1 million estimated indigents in the country based on the 2019 demographic health survey, whereby with support of this and continuous increment to do that, we'll be able to cover. Now, on the other question about that it is not universal and that the counties, some of them do not have the same cover, indeed, after devolution, we also realized that there are those staff who had been seconded or posted at the counties continued to enjoy the civil service cover that we have been having for them, the enhanced civil service cover since 2012, that there were their counterparts in the counties who did not have access to that. So what we did is that we extended this benefit to the counties so that they may also be able to join and have access to the same benefits which were mirrored, and some of them even negotiated other benefits. And it is interesting you mentioned about the chair of the Council of Governors, and Kakamega was actually the first county that, that took up the cover.
How many counties took up the cover?
As at the moment, today there are 18 counties that are active. There's one county that we are in negotiation right now to join. There are other counties that had joined, but also opted to go for other private insurers. And then there is about 21 that are yet to join. But in also ensuring that the frontline workers actually have access, in a meeting that we had today, this morning actually, with our Cabinet Secretary of Health, Senator Mutahi Kagwe, whereby it was resolved that all healthcare workers who are admitted in government hospitals for COVID, their bills would be waived. So in terms of providing support, we are continuously working together with the Ministry of Health, ensuring that we are able to cover our frontline workers, and also providing the framework and the base for universal health coverage as we leave no one behind.
Dr. So what you're telling Kenyans this evening is that you had a meeting with the CS Health Mutahi Kagwe, and part of the resolution of that meeting is that healthcare workers who are admitted in government hospitals will not pay a single cent.
Linda, that is affirmative.
Perfect. Dr. Kitulu, good enough for you?
As I said, it's a journey, and that part of assurance that those healthcare workers who are admitted or receive treatment in public facilities will get, will have their fees waived. That is a very welcome statement coming through. And of course, as I'll still go back, that there are those, as Dr. Kamunyo said, there are some of the counties which have not come on board even to take up some of those covers. This is what we're encouraging, that everyone should be covered. And even beyond those in the public sector, that those who are in whatever sector of health but are serving Kenyans and are frontliners working for Kenyans should be protected.
Yeah, because it says, I mean, from the number that he gave, what that means is that 29 counties have not signed up for that cover with NHIF. And that is a concern because of the kind of stories we've been covering in the last couple of days. But Dr. Kitulu, talk to me about UHC. It was one of President Uhuru Kenyatta's Big Four agenda. There have been pilot programs across the country in Nyeri, Kisumu, Isiolo. Do we have any report whatsoever of how that went?
Well, indeed, UHC is on our Big Four agenda, and that is a political goodwill and commitment that we cannot underemphasize, and a very welcome situation in which we are. And this goes in line with the global agenda in which in September 2019, again, there was that political commitment from all countries and, to move towards political commitment for UHC. So in that sense, yes, we have that political goodwill. Now, when you ask about the pilots that were done, indeed, I will not speak for government because I was not part of carrying out those pilots.
Yeah.
So I don't think it is my place to give that information.
Perhaps I can ask Dr. Kamunyo because I'm sure. Perhaps I can ask Dr. Kamunyo because I'm sure he was involved at some point. Dr. Kamunyo, how did that go?
Thank you, Linda. And the pilot, which was launched in December 2018 in the 4 counties, provided a lot of learnings, and that is what has also informed the shape and form that we have taken for the scale-up of UHC now, of what we call output financing or insured scheme. And it was based on the learnings that we had at that point and finding a sustainable way of being able to deliver and scale universal health coverage. And in terms of why sustainable and using an insurance model is because every individual having a premium paid for them, and then when they access services, their services, the hospitals that offer the services are reimbursed. And this creates a revolving pool of funds that is able to also increase and provide funding for the institutions to be able to sustain themselves and grow and continuously improve the services offered. And this is why, even as we discuss with the Council of Governors to ensure that the funds that even NHIF reimburses the public institutions are actually retained within the facility to be able to improve the capacity and increase the capacity of these institutions to continuously improve in the delivery of care.
Is that what's being launched over the weekend?
Yes, this is what has been going on, and as we are saying, it is a journey, and with that journey, as we learn, that is what is going to be launched. And also, as we were talking about the 1 million households that we are starting with to kickstart the scale-up of UHC, these numbers will be divided equitably across all the counties, and we are working together with the Ministry of Health that also provided a tool for identifying the indigents, but in collaboration with the counties. So at the stage that we're at, as we're waiting for the numbers of and the names of the indigents from the counties, so that we can be able to register them, biometrically register them as well. And as you know, that is part of the reforms that had been commissioned by the Ministry of Health to be able to transform NHIF into a strategic purchaser of health, so that we are able to give more value, but also at the same time avoid the wastage that comes with the fraud, etc., as we are able to identify the actual individuals who are getting and receiving the service, so that we increase efficiency and we avoid the delays at point of care, having to make calls, etc., and just using their biometric identification to be able to access care at the hospitals.
Okay. Dr. Kitulu, there's a document I was reading, and that document was written by Siddharth Chatterjee, who is the UN Resident Coordinator to Kenya, and Felipe Jaramillo, who's the World Bank Country Director for Eritrea, Kenya, Rwanda, and Uganda, based here in Nairobi. And part of that document said the delivery of UHC requires robust financing structures. When people have to pay most of the cost for health services out of their own pockets, the poor are often unable to obtain many of the services they need, and even the rich may be exposed to financial hardship in the event of severe or long-term illness. So let's talk about the funding. Do you get the feeling that healthcare service, the healthcare sector has received enough funding from the Kenyan government? Is there anything else that can be done differently, A, to ensure there's affordable healthcare for every single person, and UHC is actually achievable?
When we look at financial models for UHC, you're looking at insurance model, which is what we have taken. There are other countries which have tax-based models, like in the UK, many of the Scandinavian countries. But each country works with the model they find will work best for them. So in our model, and as Dr. Kamunyo has mentioned, it's a point of contributions from those in formal employment and those in informal sector who are encouraged to contribute. Now, the challenge with that, of course, you realize, like in a year such as 2020 with the COVID-19 pandemic, the economy has suffered. Many people have lost jobs. Companies have shut down. Not wanting to do so, but that's the economic situation. So, of course, that has an impact on how much contribution can be done. And indeed, I think in one of the conversations, around this UHC, we've had that, yes, the contributions have also been affected in terms of NHIF contribution in both the formal and the informal sector. Though you can imagine those in the informal sector who are voluntarily contributing, when their income goes down, then they fall out because of, it's a decision of, do I contribute 500? Do I buy food? Do I pay rent? So, those decisions then interfere with how much you can contribute. However, if we get to a point where we can pool those resources and ensure that we have almost, all Kenyans contributing to that fund, it will be a formidable fund. And with a restructuring, ensuring that that there is strategic purchasing of the services, and starting with, again, I keep on going back to this issue that it's a journey. And I think part of the journey now, we've said that we'll start from a primary healthcare level. And that if we cover that base, of primary healthcare and can keep the population healthy, then we'll go a long way, even with those funds that are contributed. Of course, then the government then also needs to contribute to a great amount for those who cannot contribute. And those are the ones, the indigents that we're talking about. I think there have been efforts which have been made in various programs like Linda Mama. There's the programs for the orphans and vulnerable children, the elderly. So those are attempts of government to put in funds towards covering them and again expanding the breadth of coverage. So I think in this journey, of course, there'll be a lot more that will need to be contributed. When we look at the contribution to the health budget in this country, it's probably just about 5-6% of the national budget. So the figures are still low, but I think now that we have started this journey, and we've chosen an insurance model, so that's what we've chosen. So then we have to have efficient systems of collecting, the contributions. And then once we start to deliver on our mandate in terms of the public being able to receive the services that they require in this UHC program, there will be a commitment from them also to continuously contribute because they can see the value they shall get. So there'll be our role as the public to contribute, but there's also the role of government to contribute for those who cannot contribute, because that UHC umbrella needs to cover everyone, not just those who can contribute, but those who cannot contribute as well. And at the point when they need the service, that they should be able to receive it without any financial catastrophe, without undue pressure, but get quality service that's in place. So of course, when we talk about the quality service, then government's contribution then goes up in many other ways, that it has to contribute towards that health sector in building infrastructure and making sure that there's a functioning health system. In that health system, remember, healthcare is a highly, it's a service industry, so it's very labor intensive. There we come to the health workforce. Majority of them are in the public sector. Again, that's government paying paying for their services. So the contribution from government is actually quite immense when you think about that they have to ensure that it's a functioning health system, and it has a workforce that is adequate skills, adequate numbers, and well motivated and remunerated to be able to stay with and offer the services. Remember, UHC is not machines, it's not machines offering service, it's people offering services. So I don't think we're at a point where we can say we have all the the amounts that we need to go into there. We are starting the journey, but that commitment and the political commitment needs to be encouraged, and this is what we need to advocate as the public, as professional associations, as as everyone out there who will benefit from this service.
That commitment is important, and I absolutely loved what Dr. Peter Kamunyo said about the meeting they had with the CS. I'll get him to repeat that at the end of the show, because there's an SMS I've received from a leader, and perhaps that his assurance would be very important. But Dr. Kitulu, before I let you go, so there's that commitment from the government that healthcare workers who will be admitted to public hospitals will get their bills waived. What else should be done to cover healthcare workers?
So to cover healthcare workers in terms of exposure to illness, or on a broader
in terms
perspective?
of during this time when you're facing the COVID-19 pandemic, so there's that whole insurance. NHIF says your bills will be paid. What else should the government be doing to cushion them and just tell them we're with you in this fight?
Well, there's a conversation, I think, that has been going on and has been going for quite a while now, and that it's in terms of the welfare of healthcare workers. It's not just covering them for this time where the COVID pandemic. Their welfare is a broader subject, and that is a subject where the conversation of a Health Service Commission has been broached and raised on multiple occasions. A central point where this health workforce can be, a point from which they can be distributed equitably to be, to serve the public in an equitable manner. For now, it depends on which county you are. Do they have the specialists? Do they not have? Do they have enough? For example, do they have an ICU? Do they have enough ICU nurses? Do they have enough renal nurses? So, in a sense, having that Health Service Commission where the welfare in terms of where they work and offer their skills to offer quality service That is a critical point of welfare. The same point where their remuneration, their welfare issues in terms of health covers and everything else that goes within HR can be controlled from a central point. I think that is one of the ways in which government, if looked at it, would really look at the welfare of healthcare workers.
Okay. Beyond
just thinking about when they are unwell, but at the point where you want to ensure that they are constantly able to deliver on this promise of UHC.
We wrote a letter to the President of the Republic of Kenya, Uhuru Kenyatta. I really hope he's picked a few points from you. Apart from the cover, this is what else these healthcare workers need. Stay with me. So let me bring in Dr. Peter Kamunyo. And as I bring him in, I've just gotten an SMS from Honorable Shakil Shabir Ahmed, CBS, Member of Parliament, Kisumu East. He says, I can also reveal that there are a number of cases in Kisumu East where Kisumu County did not pay more than 2 months' contribution for UHC. Hence, my constituent died in Tenwek Hospital, and her body is being held at the hospital due to uncleared bills that were not honored by NHIF because his card showed arrears. I spoke to NHIF and they confirmed. So part of the concern that is being raised out here, remember one of the stories that we did about the nurse, her remittance was not given to NHIF, and so when this happened, when she got COVID, her family had to raise money for her medical expense. So Dr. Kamunyo, I'd like you again to give a reassurance to healthcare workers out there. One, the meeting you had today, the resolutions that you had, and why this makes all the difference, especially with the concerns they have been raising. You get this actually gets to be a final word.
Okay. Thank you very much, Linda. And indeed, first is reassurance not only to the frontline workers, to all Kenyans, that NHIF, the Ministry of Health, the government is committed to ensuring that on this journey towards universal health coverage, which is progressive steps to ensure that every Kenyan residing here has access to quality health care, affordable, and meeting their needs without financial hardship. So that means that those who can pay should pay, and those who cannot pay are supported. And to demonstrate that this journey, we've been on it, and Dr. Kitulu also alluded to it, there have been programs that have been supporting the vulnerable population. Linda Mama, which is a free maternity program, in the last year, over 1 million mothers were registered and enjoyed benefits. The HISP for elderly and severely disabled, or the orphan and vulnerable children, have been on the programs for long. Edu Afia for free cover for our secondary school students, with about 2.5 million students registered. So all these programs, as we move towards UHC and rolling them into one, so that we are able to expand and ensure that the vulnerable are also covered. Now, regarding our frontline workers and regarding our covers also with the counties, we know that there are challenges in terms of sometimes remittance of the funds due to delays in various places, including from the exchequer. And interestingly today, Linda, is that after our meeting, we're also at a joint committee meeting at the National Assembly, whereby this was also brought up. And in terms and in the spirit of ensuring that we take these learnings with us to ensuring that our people are protected, we also resolved that for even from the counties when there are delays, that we will have a grace period of up to 90 days before the cover lapses. Because in terms of the lapses previously, by the 9th of every month, if it's not paid up, then the cover lapses for the counties in the enhanced scheme. But now we've agreed that to ensure that even the covers for our frontline workers are not challenged by lapses, that we will cover up to 90 days or until the funds are released.
So again, you're giving your word to millions of Kenyans out there on national television that effective today, any healthcare worker, frontline worker who's admitted in a government hospital will not pay a cent because their bill will be waived, correct?
Correct.
Perfect place to end this conversation. Dr. Peter Kamunyo, and NHIF CEO, thank you so much for joining us this evening on KTN Prime. We also had Dr. Jackie Kitulu, Kenya Medical Practitioners and Dentists Council Board member. Ladies and gentlemen, thank you so much for your time and for staying with us here on KTN Prime. A good reassurance there from the government side, from NHIF. We'll cover you, we've got you. So let's see how this now this moves on, because it's good news for healthcare workers. Thank you so much for staying with us. Let's look at other stories making headlines tonight on KTN Prime. Into the corridors of justice now, and the High Court has ordered members of Parliament to pay back 1.2 billion shillings that they unlawfully awarded themselves as house allowance 2 years ago.